welcome to this session. We have a bit of a busy agenda today, so I'm going to do a few introductions, and then we're going to move on to talk about the education program, the Allergy Postgraduate program at Imperial, then brief words about the clinical services linked to the program. We're going to hear from our students, Fran Cole and Jennifer Finnegan, who are currently students in the program. Fran is a senior nurse specialist in London, and Jennifer is a consultant paediatrician in Ireland, and they've been with us for some time, so they can share their experience. And then we're going to have Professor Sejal Seglani joining. She's going to join at 5:30 because he was busy till then. And she's going to be sharing the asthma and allergy research at Imperial. And you have the opportunity to ask questions that will be addressed at the end. So there is a chat, a Q&A button for you where you can put your questions. If there are questions that can be easily answered by our admin colleague, Tamsin, who's in the background, she will reply to you straight away. She might put some useful links to college resources, etc. But if there are, other types of questions, we're going to try and pick them up at the end and address all your queries. Okay, so big welcome there. So I'm going to get started talking about the Allergy Postgraduate program at Imperial. So I guess the bottom line for many, many people joining the program is they want to become experts in allergy. So often they come across allergy patients in their day-to-day job, and they often haven't received much proper training or education in undergraduate years, and they really want to hear from the experts what's the latest in terms of evidence-based, what's known, what is not known yet, what are the best decisions to make, say, in clinical practice or when doing their own research, and that's how most of our students come to us. So I will say you're in the right place. Yeah. So why Imperial? So Imperial is the top 2 university worldwide, which I think is pretty amazing, and it's really a fantastic community to be in. And I think this achievement is really, as it says there, from the president, is a testament to the quality and the commitment of our entire community. And that includes, of course, the researchers, the academics, but also the students. And we have so motivated, hardworking and talented students who have an amazing attitude, and they're extremely supportive to each other and really, really nice and friendly. So I think it's that, fantastic community that makes it as well very, very special. So Imperial does very well in sort of all sorts of ranks in terms of research, say in the UK, or it was named University of the Year as well in the UK a couple of years back. But Imperial has also done great contributions to allergy and allergy as a specialty, from the first attempts to inhalant immunotherapy over 100 years ago with Noonan Freeman, based at St Mary's Hospital, where we're still based for the clinical services, as well as later on Dr. Bill Franklin, who did the first clinical trial on inhalant and allergen-specific immunotherapy, and established the first pollen counts on the roof of St Mary's Hospital as well. And then key figures as well, like Professor Barry Gay, who did amazing research into the mechanisms underpinning T2 asthma that has paved the way now for novel therapeutics such as biologics. And again, that tradition has continued, and you will see some key opinion leaders as module leads, and lots of effort to continue at the forefront of allergy research, allergy clinical practice, and also education. And a new Imperial Centre, Allergy Centre, has been set up this year, and we're extremely proud of that, and it's called the Franklin Case Centre for Allergic Diseases. So that just kind of captures how important allergy is for Imperial and at Imperial. And again, we do very well in terms of research ranks worldwide, just after Harvard, the second leading team. So, and that's what allows us to have world-class teaching in the allergy MSc. We have world-leading experts as module leads, and if you've been in the allergy field or the asthma field for some time, you will recognize familiar faces there, such as Professor Steve Daran, Professor Kustovic, Professor Zaglani, who will join us later today, Professor Bush or Paul Tana, Bob Boyle, Mo Samji, Louise Fleming, etc. So, and also, what is really rich is, of course, we all bring our expert colleagues from abroad, from other institutions, to really have the leading experts in every single topic. And that's very important for us. And you have access to all of this. We have an extensive syllabus to really cover the whole range of allergy, affecting all the different target organs from all the different perspectives as much as we can. And we have a very sort of innovative, student-centered, active learning approach. So you also learn by doing in a way that is relevant to you, that you can then apply to your own professional career. The teaching and the program as a whole is very flexible. It's part-time. Most of the students we have work pretty much full-time or nearly full-time and have other family commitments. As mature students, really very busy people. And as we will see, we have an online stream where you can follow the whole program online, as well as a blended stream where a good proportion is online, but then you come on campus 3 times a year in the first and second year. And it's a very sort of international atmosphere as well, which I think makes it very rich. So both the faculty as well as the students. And that's really interesting because allergy, of course, presents differently in different parts of the world, and also things are managed and dealt with differently. And we embed all that diversity and global perspective into the program as well. So who are our students? So we have a great mix. I think most of them are healthcare professionals, but not only. We also have biomedical scientists and people coming from other areas. We've had epidemiologists, people from industry, entrepreneurs over the years. And within healthcare professionals, we have quite a few doctors, pediatricians, GPs, allergists, dermatologists, chest physicians, ENT, but also specialist nurses like Fran or dietitians joining, pharmacists. And you can see some faces there who've been students with us, and you can find the sort of the perspectives on our website. So if I look at the last 5 years, we've had over 100 students. 40% are from the UK or Ireland, 20% are from mainland Europe, and 40% are from other regions. And you see a wide spread of countries there represented, again, which makes it very rich. And we tend to put people together in groups based on their time zones, etc., so things are friendly for them. So how is the structure of the program? So as I said, it's a part-time program. So it's spread over 2 to 3 years. So in the first year, everybody does these 3 modules: the scientific basis of allergy, which is all about the mechanisms and the science underpinning allergy, and how that relates to the clinical presentation, the diagnostic tests, and the therapeutics, including novel therapeutics such as biologics. And then the second module, diagnosis and treatment of allergic disease, is a very clinical, very practical module where we go through evidence-based practice on all the different areas of the specialty. And then finally, you complete the cutting edge of allergy module where you are presented with the latest evidence, the hot topics in the specialty, and then we give you the skills to develop your own research skills, to develop your own research projects and critically appraise the literature. So you can carry on doing that when you finish the program and you continue to learn and follow this really sort of exciting and rapidly evolving specialty. So you can choose to exit there, and you will exit with a postgraduate certificate. Most of our students carry on, they don't exit, and they join the second year where you have these 5 modules. The food hypersensitivity module is all about food allergy and all the differentials. And in the whole second year, we go into much more detailed scenarios, complex diagnostic and management procedures, and sort of discussing more all the different nuances, as well as the latest research, the unknowns, the knowns, and where research should focus in the future. So that's the case of food allergy, food hypersensitivity, as well as the rest of the modules. So we have the rhinitis, rhinosinusitis and immunotherapy module, the asthma and allergic airways disease module, we have the allergic skin disease and drug allergy module, and then a pediatric allergy module where we cover complex scenarios within pediatric allergy, including adolescent transition, safeguarding, immune deficiencies, etc. So again, people can choose to exit at that stage, and that will be a postgraduate diploma in allergy, having completed the first and second year. And again, most people these days choose to continue with us and do the research project and exit with the MSc in allergy. The research project can be done as a standalone 3rd year, or some students choose to do it within the 2nd year with these 5 modules plus the research project. And then, as you can imagine, it is a very busy year. So each of these 3 years is 30 credits. Okay, so it's quite a bit of commitment, but again, most of our students are working professionals with busy lives. So it's, I always hear from them, it's all about getting organized and being motivated, and our students are really motivated. So just to say that research projects can be imperial projects that we offer every year, or local projects that people might choose to do in their own institution. And if that's the case, you also get an imperial supervisor for additional support. So you can do all of these, including the full MSc, purely online if you join the online stream. And that means you don't have to come on campus at all at any point. Or you can join the blended stream, which means that a good proportion is going to be online together with the online stream, but you're going to be coming on campus one day or 2 consecutive days, 3 times a year in year 1 and year 2. So say if I was to represent those days where people in the blended stream come on campus, it will look like that. So towards the end of the module teaching, you will come for 1 or 2 consecutive days of teaching on campus. And those days are actually hybrid teaching, where for a good part of the day, we have the online stream students joining in with hybrid facilities and the people joining on campus there with us face to face. Okay. And second year will be something similar. Okay. So how do we teach? So things have evolved over the years, so we're very proactive in incorporating new ways of teaching. So again, you can do online or blended stream, and in both cases, it involves both asynchronous learning materials, so materials that you access in your own time, as well as synchronous teaching. That means live teaching, where you have to join at that time, and attendance to that teaching, live teaching, is mandatory. So within the asynchronous materials that are sitting there for you to watch and access in your own time whenever works for you, you will find a range of materials of recorded content, lectures, mini lectures, interviews, podcasts, practical demos or sims. You will have reading lists for every module. You will have useful web-based resources, interactive exercises, tasks, and a number of other things. And then for the live teaching, part of that is online for everybody, and part of that is hybrid, again, where online stream students will join online and blended stream students will join on campus on the same day. And live teaching is very much for interaction. It's not like for didactic teaching in one direction. So it's very much for you to take part. So often we have Q&As with all the key speakers. We have case-based sessions or focused discussion sessions. You have workshops, role play, simulation, lots of group work. So you get allocated into the group at the beginning of the year, and there's going to be quite a few sort of group tasks for you to do. That is going to lead to student-led sessions such as journal clubs or pro-con debates or presentations. And then there's going to be hands-on practical sessions for the people coming on campus that then are covered online as interactive exercises or demos or sims online for the rest of the cohort. So if you think about how a module might look like, so say we launch the module as a launch webinar where you can access pretty much all the asynchronous content and get organized and start working on things. And then about 2 weeks later, we have the first online half day. And then every week we have an online half day for say 3 consecutive days. And then we have the hybrid teaching day or teaching days. So that's your live teaching. So those 4 or 5 days is your live teaching together with all the asynchronous content. And then 4 weeks, 5 weeks, once the teaching has been completed, you have the deadline for your assessment. Okay. And that's very much the same for every module. In year 2, where we have 4 smaller modules, we group them. So the hybrid days are sort of very close, they're consecutive. Okay. So what sort of assessments can you expect? So a wide range. And again, this is very much authentic assessments. So for you to practice different skills, different elements that probably are going to be really helpful in your future career. So from, say, writing a case report, running a mock allergy clinic, writing a research grant application, presenting a poster or an abstract as if you were in a conference, presenting a complex case as a group to a multidisciplinary team, a patient information event, writing a review paper, and then quizzes and exams for a couple of modules. And of course, if you do the MSc, your written thesis, which follows the format of our original article. So it's very easy then for our students to send that out for publication, which is really what is happening for most of our students now. They do really good quality thesis that then can be published in peer-reviewed journals. So how does the asynchronous materials look like? So this is, we use a platform called Blackboard, and you now have a number of areas to look at. We always record a video on how to navigate the module, so you know where to go, where to click. But we put our sessions in these sort of colorful tables, and there you can access all the recordings, podcasts, etc. We highlight any tasks that you might be working on for your live session, and that's what you see when you click on the click here button. So different topics where you're going to find recordings, etc. And then again, we have interactive cases and a range of things, theme scenarios, consultations, cases, quizzes and interactive diagrams, practical demos, virtual tours into the lab or the clinical research facility. And this is when we do the synchronous teaching, the live teaching. So this is when we're all online. So it doesn't look very exciting, as in the picture, but it gets very lively, very interactive. We laugh quite a bit as well. And then that's when we do hybrid teaching, where we have students on campus as well as students online, and they're both streams equally important, and people at home have the capacity to speak, to put their hands up, to type in the chat, to present. So they're very, very present. And this is, different ways how we gather feedback and we promote interaction, for instance, using Mentimeter. So these are some of the hands-on on campus sessions we do. So you see anaphylaxis in training, trying lots of different creams, doing nasal endoscopy or skin prick testing, doing, trying foods that we use for double-blind food challenges, so a range of things, really, really interesting. So moving on to the final bits. So often I get the question like, what's the application deadline? Because it's not on the website and it's not meant to be. Okay, so if you're a home student, it doesn't matter if you apply for blended stream or online stream and your deadline is August. The fees are also the same for blended stream and online stream for home students, okay? And then deadline for overseas students, if you want to join the blended stream that requires on-campus attendance, the deadline is end of July 2025, and that's because of visa requirements. And then if you're joining the online stream, the deadline is same, end of August, okay? So funding opportunities, we at the department NHLI offers a number of scholarships, so 4 scholarships in total, as you see there. So 1 worth 3K and 3 worth 2K towards the PG Cert fees. And then we're very lucky to have the support of the Breeze Family Charitable Trust scholarship that funds a student either overseas or home willing to do the full MSc and covering half of the fees for a home student, say. So that amount, you see 7K there, which is the equivalent to 50% of the MSc fee for a home student. But all these scholarships are open both for home as well as overseas students, and the deadline is the 2nd of June, so have a good look. You must have applied to the program to be eligible, okay, but you can access the information on the website. So there's also the Faculty of Medicine Master Scholarship that you might want to look at. Okay, and the deadline is generally earlier. So the fees are on the website, so people sometimes struggle to make sense of it and, fully understand. So this is, say, for the whole MSc, for instance, for home students, as you see, is 15K. And then lots of people, or some people, rather than joining for the MSc, they join for the PG Cert to start with. But, it's completely up to you. And they pay initially, the PG Cert fee, and then they do top up to the 2nd year and then top up for the 3rd year. So at the end, you end up paying the same amount, but sort of split throughout the years, okay? So what do our students do when they finish? So again, quite a few of our students are clinical and they go into more specialized, more senior clinical roles. So lots of them have become the lead clinician, the lead nurse, the lead dietitian within their teams. They might have secured a consultant job or a GP with a special interest job. More people now go into private practice. as a whole or standard alongside the sort of more public sector role. And often people help develop their MDT, the multidisciplinary team around them. So they really foster that sort of culture of learning around them and improvement around them. Some people go into research and do MDs or PhDs and become principal investigators after that. And some students have had good job opportunities or career progression within research. So we have students who've gone into being the lead allergy research nurse in a team or senior research fellow, or they're now working in industry more in a research position. And some people work in industry, also contributing often to research in jobs like clinical research physician or medical advisor or more senior positions within industry. So quite a range there. So I'm just going to touch on the clinical services feeding into the program and then very briefly into the research. So there's a range of clinical services that are very heavily involved in delivering the program, the faculty there. So allergy services, both adult and pediatric, both at Mary's and the Brompton, respiratory medicine, mainly at the Brompton, dermatology, mainly at Chelsea, gastroenterology also at Chelsea and Charing Cross, ENT based at Charing Cross, and then other services just such as ophthalmology in the Morphyli. So we're all very sort of centrally located in London. We teach now in South Kensington, in the South Kensington campus and Brompton campus, so still very central and a very sort of nice atmosphere there. And just as an example, so the pediatric allergy service where I'm based at St Mary's is one of the largest tertiary referral centres in Europe. We're a very multidisciplinary team with doctors, nurses, dietitians, speech and language therapists and psychologists. We have strong links with other specialties, including dermatology, gastroenterology, respiratory medicine, ENT, and general pediatrics. We see over 6,000 children a year with a whole spectrum of allergic diseases, but we have a strong focus on complex patients, holistic care, and patients' education, including adolescent transition. Very strong evidence-based practice, a lot of focus on translational research, and we're lucky to have a children's clinical research facility that is very active, where Paul Turner is the lead. And then we are a training centre for UK GRID trainees, SPIN trainees, as well as international fellows. And we are the lead for the North West London network of allergy. And this is just in a nutshell, the service where Sejal works, the clinical service. So there are very experienced service on problematic severe asthma and really characterising that type of patients and telling apart who has difficult asthma and who has severe therapy-resistant asthma. Difficult asthma being patients where control is poor, but there are modifiable factors that could be tackled and that to make that control much better. So there's a lot of focus on multidisciplinary team working with a range of specialists as well, with quite a lot of focus on improving adherence and behavior change towards those goals. And then in the more severe therapy-resistant asthma cohort, a lot of interest and research going into phenotyping, understanding biomarkers of the different endotypes of asthma, with research into monitoring and non-invasive measures, and then to develop targeted therapies, truly precision medicine approach backed by clinical trials. So really, really interesting, really powerful team, and very, very active in research, as you will see with her slides and her presentation. So I'm just touching on the allergy and asthma research. So we have a number of areas within NHLI that are strong interest for us. So mechanisms of immune tolerance, anaphylaxis, and FPIES. My main research is in FPIES. Endotype discovery and diagnostics, and that expands, of course, to asthma, primary prevention of allergic diseases, environmental control interventions, particularly for eczema, and then allergen immunotherapy for environmental allergies as well as food allergy. And you see the different teams there and the different areas. So with that, I'm going to stop there. We have a few questions we've received, and I put them there. But I'm going to leave it to the end, and we're going to move on now to our students. So I'm going to hand over to Fran, who's going to share her experience with us. And I see Sejal has joined. Hi, Sejal. Thank you.
Thanks, Marta. I think listening to that made me tempted to sign up again. So I'm in my third and final year of my allergy MSc. And my name's Fran. I'm one of the paediatric allergy nurse specialists at the Royal London Hospital. So I had wanted to do the allergy MSc probably for quite a few years before I actually signed up. and managed to talk myself out of it also for a number of years. Mainly because I'm a qualified nurse, qualified over 20 years ago, and I hadn't really done any like academic courses during that 20 years. So the prospect of undertaking a master's was really quite daunting for me. However, I felt like the allergy MSc was really a missing piece for me. I'd worked in paediatric allergy for over 10 years, and before that as a paediatric respiratory nurse specialist. So I felt like the course at Imperial was really going to help me build on the foundation that I'd learned in my years in clinical practice and give me a greater depth of knowledge, and therefore to be able to provide a better service to the families that I look after. However, the first sessions were a little bit daunting, trying to get to grips with how studying has changed in the 20 years since I'd studied. And I laugh now because the first time I turned up on campus, I pulled out my pen and notepad because that's what I would have done 20 years ago. And all the other students were there with their laptops and their fancy software. So I've definitely had a learning curve of how to be an adult learner, but everyone's been super supportive. And it was reassuring when the first sessions, the people from all different clinical backgrounds were also apprehensive, and it provides a really good support network for everyone to bounce ideas off of. Everyone's coming from different backgrounds, which brings a lot to the table. You're split into smaller groups early on so that you can do your group work together. And I know my group, I've been really grateful for, have got me through. And it just provides a nice, safe space to ask questions. They're a good sounding board when you're not sure or struggling on something. So the small groups, not only for the assignments, but also as a support network, has been amazing. And the things I like most about the course, there's a lot of self-directed learning, which means it can fit around other responsibilities. So for myself, I have a 10 and 7-year-old, and I work clinically as well, as Marta said, a lot of people do. So just trying to be able to fit it in around all of those responsibilities has meant that you can manage your time effectively and make sure you're coming to the campus days ready to go. So there's the option of obviously doing the blended stream or just online only. I did the blended, so I went on the campus days, and I know I really enjoyed those campus days and seeing everyone and seeing some of those pictures that Marta shared just brought it all back. But I also feel like the students that joined online, that were online only, they were no less of a support to all of us. They all felt part of our group, and we all looked forward to seeing each other, whether it was in person or online. So it was a really nice network and provided a safe learning environment. Would I recommend the course? Yes, absolutely. The last 2 years have been amazing, of course, hard work, but I can already see the changes in my clinical practice and the things I'm able to bring to the families that I look after. And my hope is eventually there'll be some career progression at the end of the MSc, which will be amazing. But not only has the course helped me build my knowledge in allergy, I also wanted to show my 2 children that you can go back to studying at any time, and you can achieve that. So yeah, it's been an amazing experience for me.
Fantastic, Fran. Thanks so much for sharing that with us. We're gonna move on to Jennifer.
Hi, thank you. I have a couple of slides that I'm just going to share. Can you see those okay? Super. Thanks, Jennifer Finnegan is my name. I'm in the 2nd year of the program, so pursuing the diploma at the moment. So made a few brief notes. The things that I find best about the course is the nice mix between asynchronous and synchronous learning materials. It gives you the opportunity to do a good proportion of the learning on your own time. Obviously, everyone has busy schedules, so this is definitely a benefit of the program. A lot of the asynchronous materials also give you the opportunity to watch lectures and prepare questions that you might have for the face-to-face days on campus, which is also really useful. As Marta went through the modules for the first 2 years, they're really unique. Last year I think was as first year was a little bit of a challenge for some people in the course, including myself, and particularly the heavy immunology focus and research focus. Whereas this year, I'm really enjoying it much more. It's a lot more clinical, and it's also a lot more pediatric. So I feel you can really feel like you're getting a lot more hands-on. The faculty I find are really, really helpful, particularly in relation to feedback. They always ask for feedback. And I found in second year in particular, in response to sort of workload, assignments, and group work, they really seem to have taken some of our feedback on form, and the course evolves based on what's working best for people. Um, the other benefit of it, I think, is the flexibility. As described, you can proceed with your MSc, do it alongside your second year, or do it as a standalone as a third year, which is what I plan to do next year. And even within the course, a number of people have decided to defer a year or perhaps defer one or two modules. So there's that flexibility. Um, so I'm in the hybrid program. I live in Ireland, so for me it's been a real treat to spend 3 weekends in London every year. So that's definitely an advantage for anyone thinking of signing up to the hybrid. Um, for me, I'm a general pediatrician. I am interested in allergy, and I hope at the end of the program to be able to set up and run an allergy service in my hospital. So that's what I hope to get out of this. Um, and it's certainly given me the skills to do that. Within the program, there within our year, there's lots of pediatricians, there's a big number of GPs, some nurses, and then a lot of people who are actually sort of non-clinical or more research focused. And so for that perspective, the course really does have something to offer everybody. Um, Again, I like the mix of learning, the asynchronous and synchronous, as well as the online versus in person. It's a nice mix. I think once you get your head around Blackboard, Tamsin can agree with me. She's heard from me a couple of times. It really is quite easy to navigate once you know what you're doing. And I would definitely tell people to make sure and attend the pre-course lecture. I missed the first one, and I was about 2 weeks in before I realized I couldn't see what everyone else was seeing because I was using the wrong browser. So, give yourself a good start, and it'll all make a lot more sense. Um, and so, as the others have said, the online component is actually a lot more interactive than you would expect it to be. People really do get involved and share learning and experiences as well. And another benefit of the program is that there's a lot of student delivered content. Like Marta had said, there's sessions where you present to a parent as a lay person, and each group will present on a different topic, which just helps cover more content more quickly. And obviously the on-campus experience then is fantastic as well. In second year now, we're all really getting to know each other and starting to socialize on our face-to-face days, and it's been really nice to see how people are doing allergy differently in different countries, or how people are managing to run a service with limited resources. So it's nice to have that shared experience among colleagues. So as I said, it took me a little while to get my head around the online system, but once you know what you're doing, it's fantastic. Um, Again, it's the pre-course kind of lecture is fantastic. It really gives you an idea of the timelines and the assignments that will be due for each module, so helps you to sort of plan accordingly. Again, the ability to do a lot of this on your own time is really, really helpful. I think the most difficult part was probably kind of planning to meet up as a group, because people had different schedules. And certainly there's a significant workload, but it was nice to have a break over the summer months before moving on to year two. Coming to the end of my slides now, what are the academics like in the faculty? Well, they're super, really approachable. It's really nice to get to see what people's research interests are and find, the right person that aligns with what you want to do your research in. And I think a huge benefit of the hybrid program is actually interacting and meeting with some of the academics and the faculty face to face. It's been a real benefit. And a little bit of repetition here, I guess. The course is really varied. Lots of clinical people with clinical practice, but equally there's some non-clinical, and it's great to learn from each other. And yeah, I've kind of covered that, I guess. So yeah, I'd wholeheartedly recommend the course. And personally, I'm getting an awful lot out of it. Again, it's great to be introduced to the faculty and kind of share learning within the group. There's a huge amount of reference material that I wouldn't have known where to look for without the course as well. And again, learning from classmates' international experiences, has been really helpful. So that's it for me. Thank you.
Thanks so much, Jennifer. Really valuable hearing about your experience. Thanks so much for that. So we're gonna move on to Sejal. Sejal, you happy to share screen?
Hey everyone, see if I can find my.
So I've done a bit of an introduction before. So Sejal is a professor in pediatric respiratory medicine at Imperial, as you see on the slide, and she's the head of our section within the National Heart and Lung Institute.
Hey, so welcome everyone. Thanks for taking the time out to join this. I'm just giving a really brief overview of what's going on at Imperial in terms of research. We're quite proud of our kind of research portfolio, and we try and make it obvious that research and clinical should go hand in hand because we're all striving for excellence. We're all striving to improve the management of our patients, and so we need both things. I think Marta may have covered some of this. There's a lot of research going on in food allergy, and peanut oral immunotherapy is we're doing a lot of work around that. So there's the food allergy, eczema, and allergic sensitization use of immunotherapy for the patients who have got kind of single allergen sensitization, both grass pollen and house dust mite immunotherapy. And there's quite a lot of asthma research going on. So in preschool wheeze, we're doing research to define how to treat these patients, how to phenotype them, how to improve their management, and quite a lot of basic research to look at mechanisms that drive preschool wheeze. We're trying to find new ways and new treatments for these patients. And critically, we're doing a lot of work around biomarkers for the younger children. We've got more and more biomarkers for older children and adults, but it's applying that even earlier if we can. And there's a lot of research across the age spectrum. We kind of think of ourselves at Imperial as looking across the life course in all of our research, but especially in allergy and asthma research. And we see it as a kind of continuum between the teams. And we're doing clinical trials on the use of anti-inflammatory reliever therapy. I'm sure you're all aware of that. A lot of data in adults, but very little in younger children, and ongoing trials around that. And a lot of research on children with really severe asthma and how we can improve their management, how to phenotype them and look at the lower airways and look at mechanisms. So as I've just said, we're really keen on emphasizing the whole course is about across the life course. It's not a pediatric course. It's not an adult course. It's actually trying to really help you understand how everything that happens at every stage across the lifespan can impact outcomes, and how everything kind of talks to each other. And it's about lots of giving you an idea about the kind of cutting edge methodologies that we're using in research. Data is huge now, how we're applying that, how we're applying computational modeling, machine learning, doing clinical trials and looking at basic mechanisms. And I think one of the things we're really lucky here at Imperial is science, technology. We've got engineering colleagues doing research with us. We've got mathematicians, computational scientists. We're all working together in a kind of interdisciplinary way. So to give you that approach. Of course, you know this, right? We need to improve our management of children with asthma because it's the most common disease in children, but also actually we have a lot of asthma deaths in the UK, and it's really expensive in terms of healthcare resources. And this is kind of the more recent data about asthma deaths, second highest asthma deaths in the world, looking at Australia, the Western world, US and Europe. So this isn't something we're proud of, and we need to improve this. And so we do spend time thinking about how we can improve asthma management. And as you all know, this is all about thinking about what's causing the airways to become obstructed in these children with asthma, and how can we prevent that, and how can we prevent children from having attacks. We know that children with asthma have reduced lung function. We do workshops on how to do spirometry, how to interpret spirometry, quality of spirometry. So you get a lot of hands-on experience actually with all of the modules, not just the asthma module, but all of the modules involve hands-on workshops to really help you understand how to do it in your clinics. As Jennifer's just said, she wants to set up a service. You need to be able to do it if you're going to set up a service. So we do our best to give you hands-on work. But this is, I guess, key, right? Severe asthma in childhood is associated with reduced lung function, which then tracks to adulthood and actually can become COPD. And so in our kind of adult colleagues are seeing our patients almost when it's too late. And that's why we do have an interest in early life asthma. This is the basic pathogenesis of asthma, where numerous exposures can result in the parallel development of inflammation, structural airway changes, and inflammation and remodeling. And the key inflammatory cell is the eosinophil. And we have a program where we use bronchoscopy to look in the airways of these children with really severe symptoms. That's a fiber optic camera we put down into the airways, and we can look in the bronchoalveolar lavage, the fluid that lines the airways, to look at inflammation, and we can take biopsies. And this isn't just what happens in children. Obviously, I'm in charge of the pediatric program, but our adult colleagues are doing the same. They're doing bronchoscopic research to understand what's going on in the airways of our patients with severe asthma and difficult asthma to help improve treatments. And that's what the research is all about. And our pediatric data has shown that children with severe asthma, as you can see, have a lot of eosinophils in their airways. Despite high doses of treatment with steroids, they've still got lots and lots of eosinophils. And the one thing that really distinguishes actually children from adults is the majority of our pediatric patients have multiple and severe allergen sensitization, including aeroallergens and food allergies. And that's where the kind of whole course comes together, how allergy then can feed into other diseases such as asthma, which is the lung, equally the gut, eosinophilic esophagitis, and allergic diseases. So we're looking at kind of all the components, and of course the skin and eczema. So it's all about kind of the full picture of allergy in the context of the various diseases that can result from allergy. And we look specifically at the Brompton, at children with really severe asthma. And we know, as you know, the reason we give our patients steroids is so that it can dampen the eosinophilic inflammation. But what we know in these really severe patients is high doses of steroids don't seem to be enough. And so we need new treatments and treatment approaches to dampen the inflammation and the high levels of IgE that they have, because they've got such a lot of allergen sensitization. And so what we're looking at is the role of newer treatments for these patients. And this is basically looking at targeted treatments. And I'm sure you've all heard of biologics for severe asthma. And what we're kind of trying to work out is which biologic would be right for which patient. Will a patient do better with one biologic or another one? And that's kind of what our research is focusing on at the moment, because more and more biologics are becoming available, but how do we use them and who should we use them in? And what we've shown, when you give children a really high dose of steroids intramuscularly with an injection, they do improve. So they're not completely steroid resistant. It's just that they need high doses of systemic steroids to improve their inflammation symptoms and attacks. But one of the things that does reduce when you give a high enough dose of steroids is IL-5. And that is what is blocked by this relatively new antibody, monoclonal antibody called mepolizumab. And mepolizumab blocks the action of IL-5, and IL-5 then cannot promote the growth, recruitment, and survival of eosinophils. And so it's a way of blocking the action of eosinophils, and it's a potential steroid-sparing agent. And so what we're doing, having worked all of that out with our kind of basic research, is a clinical trial right now that we're leading on, which is a national trial comparing two biologics in children with severe asthma and trying to work out which child will respond better to a reduction in eosinophils and which child will respond better to reduction in IgE. So a head-to-head comparison of mepolizumab and omalizumab. So I hope you can see we go right from the basics of working out what's going on mechanistically in the airways to then applying it clinically in clinical trials. And the other group of children we're really interested in are the preschoolers, because we know that very young children, although we have these preschool children that come in again and again and again with wheeze attacks, they're often the ones that do end up in trouble and carry on and have symptoms through to adulthood and can present with COPD in adulthood. And the burden in terms of presentations to primary care is increasing, and the majority of hospitalizations for wheezing actually in the UK are children aged between 1 and 5, and this hasn't changed for 15 or 20 years. So we're trying to think about better ways of managing these patients to prevent attacks. And what our research has shown is we've done bronchoscopic studies in this age group and shown that some of these children already have eosinophils in their airways and already have remodeling. And so what we're now trying to do is find the children who have got this evidence of change, pathological change in their airways, to give targeted treatment to them as well. So rather than just treating all preschool wheezers as the same, we're trying to get a bit more targeted and trying to give appropriate treatment according to an objective marker, which is eosinophils. And this trial showed that children that had sensitization and high blood eosinophils were most likely to respond to daily inhaled steroids, which is that red bar that you can see there. And we were also then looking at the children who are the real nightmare, which is the children that keep coming in with infection-associated wheezing, you know, the ones at this time of year who are like crowding our emergency departments with viral-induced wheezing. What's causing that? Why aren't we able to stop them from having attacks? They're non-allergic, they're non-eosinophilic, and if anything, they seem to be more neutrophilic. And what we've shown is actually a lot of these patients have bacterial infection in their airways. And so we're now looking at whether antibiotics in those patients will be beneficial. And those are kind of the trials that we're working on now. And you know, we've done lots of different types of approaches. We've done cluster analyses, data-driven analyses, and we're essentially coming to the conclusion that preschool wheezing seems to be driven by allergies in a lot of children, but infection in a lot of children. And we're trying to work out how better to manage them clinically using biomarker-guided treatment. So severe asthma research program, or the asthma research program at Imperial, is very much translational. Yes, we do have some very basic work that goes on, the basic science to work out the mechanisms, and you learn about that, you learn about the approaches, and then we go right all the way to the clinic, doing lung function, doing clinical testing, making sure the children are taking their treatment and taking it right, and then bringing it all together in clinical trials to really move management forward. So hopefully you'll appreciate that cycle when you join. Yeah, and that's it. Thanks, Mark.
Fantastic, Sejal. Thanks so much. I really enjoy your talk. Great. So we're coming to the last bit. So we're going to be addressing a few questions we have received. So one question is whether we can release the dates for the live online sessions for next year. So we usually put that together towards the spring. And then as the students are coming into the program, we share that as preliminary dates. So it's not something we have now, and it's not something we generally share with kind of people who haven't sort of applied to the program, but definitely something we share early on so people can plan well in advance. Then there was a question about whether people can come to do a clinical attachment in the clinical service. So I will say that's kind of completely separate to the allergy postgraduate program. We, as well as the team at the Brompton, we have limited capacity for people to come and observe with us. So it's quite restrictive, and there's a cost linked to that. Of course, it's a very valuable experience, and we are open for that as well. So you can email us about that. But I will say joining the Allergy program really gives you, you know, the best essence of all you need to learn, really. It's very curated, so it will take you many months, probably quite a few years, to really come across in clinical practice with the spread, the complexity and the richness we tackle in the MSc. So some of our MSc students decide then, after doing the MSc or whilst doing the MSc, to come and spend some time with us in the clinical service to see practically how we organize the service, and that's very valuable as well. But I wouldn't say you get the same experience from being in a clinical service compared to doing the MSc. And then there is another question about why to join Imperial when there are other programs out there offering also allergy MScs. And I will say, you know, I wouldn't underestimate the fact that Imperial is the second best university in the world. And I think, you know, it's kind of early, you know, easier said than done. You know, it's really powerful. And I think that comes, of course, with the resources that the institution has, but again, with the great faculty, the great academic body, as well as the great students. And then relating that to the program, I mean, you have key experts as module leads, as key faculty, that they're not going to just deliver a lecture as they might do for a conference or for another program. They're going to be there. You're going to see them multiple times. You're going to be asking questions. You're going to be reaching out to them if you have questions about your own working environment. If you have an idea about a project, I had a chat the other day with someone who had a poor experience with a cruise ship this summer and wanted to do his project on that. So we explore who's the best person within the department for that. And again, I guess it's about critical mass. So you have this great group of experts really invested, really passionate about sharing and spreading that knowledge and that passion as well. So I don't think, you know, I think we're in a privileged position in that sense. And of course, that comes with then our ability to offer projects within Imperial. And this year we've offered over 16 projects for students doing their MSc. And again, it's a range of projects. Many of those can be completed remotely in a range of topics. So again, you need that critical mass of people doing research and having ideas and having projects to be able to offer that. And that can be the stepping stone for then people to go into further research, PhD, etc. And also, we are the only MSc, as far as I'm aware, who, you know, where an on-campus element is offered. And as you've heard from Fran and Jennifer, we really see the value on that. There's a lot of hands-on practice that goes into that, but it's also the more personal social interaction that I think is also so important to have this well-rounded experience that the blended students really seem to appreciate. And of course, you know, online students have access to equivalent materials, they meet the learning outcomes, but some students really benefit from that on-campus element as well. So I think, you know, there are unique features to our program, and again, we're very invested, we really put a lot of time, a lot of interest in the program, and I think that's what kind of transpires, I guess, when we hear Fran and Jennifer talking about how the faculty is like and how the community is like. And I think that's quite probably unique to Imperial. Would you like to add anything, Jennifer? Sejal there, or Fran? I know Jennifer had to leave.
Nothing from me other than we're here to help, and yeah, I mean, as Marta has said, we often get asked why Imperial, but there's a reason that Imperial does score highly as a university. But we'd like to hopefully, I mean, I don't know, Fran, what you think, but we try and make you feel welcome. It's not a snooty, horrible, arrogant environment. We're just all normal people, and we just want you to enjoy. Because we enjoy our asthma and allergy, we want you to enjoy it and learn from it. Yeah,
definitely. The passion comes across from everyone. You've all been brilliant. I think the only thing I wanted to add that I forgot to mention was that I did secure funding for, and so did some of the other students, from the Evie Dove Foundation, and they're an amazing charity who provide funding to healthcare professionals for various different courses, a really easy application process, and they're really good at communicating quickly. So that's the other thing I would say to people if they're looking for any funding for their course.
Thanks for that, Fran. So yeah, so a number of students have secured funding outside of our scholarships over the years, and that's a very good idea. So thanks so much, Fran, for that. Lovely. So I think we're going to come to an end. Thanks so much for joining today, and please reach out to us with any questions. And we'll be looking forward to applications for the coming year for start in September 2025. Thank you so much.